welcome to this discussion on the role of artificial intelligence in healthcare. With an ageing population, siloed medical departments, and the rising burden of healthcare costs on the public purse, what role can AI and deep learning play in improving treatment and rapid diagnoses? Joining me today is Professor Sotirios Tsaftaris of Canon Medical, Royal Academy of Engineering Research Chair in Healthcare and AI at the University of Edinburgh, and Dr Ken Sutherland, President of Canon Medical Research Europe. Welcome to you both. Ken, if I could start with you, what's the current state of healthcare, and are we headed for a perfect storm?
Thanks, Jamie. Yeah, it's a really interesting question. At the moment, what we're seeing is really we're becoming victims of our own success with healthcare delivery. People are living longer, but they're not always healthy for all of that time, and they need ongoing care. People in their 50s, 60s, 70s, 80s, 90s, and now well into their hundreds are living long, but they are living longer with additional care needs throughout that period of time. So they need attention from what is essentially a dwindling level of number of people providing that health care and that health and social care together to let them stay healthy. Couple that to the requirement to try and deliver healthcare as efficiently as possible in terms of cost, because the public purse particularly is always stretched. It is a really challenging time to be within healthcare.
And it would be remiss of me not to bring up the impact of the ongoing pandemic. We have seen a huge amount of backlog of patients who need non-urgent care. What kind of impact are you seeing there?
Yeah, I think it's a real challenge. There are many people that now within most healthcare systems that are essentially queues at different stages in the process. So you've got a queue of people needing diagnostic tests before we can even decide which of those need additional care needs and which of these are actually healthy and can go back to their normal life if that's possible. I think the other challenge here is that you've got a combination of effects still going on. The pandemic is still happening as we speak just now anyway. We've got this backlog of people who've unfortunately not been able to get care because care facilities have been focused on pandemic response for the last year and a half, 2 years now almost. And then also you've got these people who've got what we don't really understand yet, long COVID, all of whom need significant investigation and understanding of the conditions. So what the situation 2 years ago was tough, now it's even tougher. And the pressure that the individuals are under and the system is under in most healthcare delivery situations is incredibly challenging.
And Sotos, what developments are you seeing in image analysis and AI to help diagnose and understand disease better?
Yeah, thank you very much, Jamie. But before, let me at least explain a little bit why we need to teach computers how to see images. So if you give a baby and you show them first time what is a ball, they immediately understand what is a ball, okay? To a computer, whether you show them a ball or do you show them a car, it's just a bunch of numbers. It's just a series of numbers. An image of a ball is a number. An image of a cat is another bunch of numbers. A computer cannot understand this, what these numbers represent, that they represent something about a cat or something about a ball. So over the last few years, actually less than a decade actually, we are witnessing a rebirth of what we call neural networks. These are computer programs that learn patterns through examples. And basically in order to devise these models, you devise these networks, these programs, you give them a collection of several examples of images, and you say, this is a ball, this is a cat, this is a dog. And then they somehow learn to extract combination of numbers that, okay, this combination of numbers most likely belong to something that looks like a cat. So, and they're not new, but over the last decade, we have found how to extract these numbers and these patterns using very big neural networks and lots of data and lots of computation. And there are wonderful examples of how such technology, such type of neural network-based AI has provided, let's say, algorithms and programs that can detect, let's say, a suspicious mole on somebody's skin from a non-suspicious mole. Or even behind the scenes with radiologists now working across the hospitals, they rely a lot on software that behind the scenes use a bit of AI as a way to make their life easier. But I don't know if any of you is wearing a smartwatch. I don't. I'm a huge fan of mechanical watches, but even smartphones, smartwatches actually contain AI algorithms when they try to detect whether you have arrhythmia or not in your heart.
Ken, have you got any practical examples of this that you could share with us?
Yes, Jamie, it's really interesting. What picking up on what Sotos has said, we've been looking at this challenge for some time now, and we've identified some opportunities where we can, what's called capturing the low-hanging fruit, as it were, where you can try and look at fairly well understood patterns of disease and try and train the computer to recognize them. A recent example we've published is on the cancer mesothelioma, which is a type of lung cancer that's related to exposure to asbestos. And it creates this very unusual lesion around the lung. It's very debilitating. There's no treatment, sadly, and it affects generally older men because they've been exposed to asbestos normally through their work career. And what we're trying to do is work with clinical experts to see if they can find treatments or in any way the disease progression can be delayed. And a critical part of working out whether a treatment works is to see the impact on that lesion. Now, the lesion's a very odd shape. It's very difficult to measure. So what we've implemented, what we've created is an AI-based system that can measure that lesion and therefore give the clinician some feedback on whether the treatment they're attempting is actually having an effect positively to reduce that tumour or not. And that's just one practical example. Now, the challenge is, as Sotos has already mentioned, to create systems like this, we need lots and lots and lots of examples of these images, in this case, images of that type of lesion of the lung. And that's a real challenge. Bringing all that data together is a real complicated challenge, one of the many challenges in this area at the moment, actually.
And what about the human aspect of machine learning? How can humans and machines complement each other to improve healthcare?
Yeah, again, a really interesting question, Jamie. I mean, the first reaction from many people is to think, oh my God, the computers are taking over. We're going to be replaced. The professional clinicians. I don't believe that for a moment. My parents were both doctors within the UK NHS service here, and so I'm very aware of the work that doctors do and the caring role they have related to their patients. The computer's certainly never going to replace that. But also what the computer's never going to replace is the actual decision-making, in my mind. What it's going to do is provide advice, support, assistance, decision support, we would call it now. It's providing information. So in the example I've just given, where we're looking at this complex lesion within the lung, for example, what the AI will do is give you a measurement and say to the doctor, either this treatment's working or it's not working, for example, or it looks like it's not working. It's then down to the clinician to make that decision. Now, what we're hoping, certainly, is through AI, we'll take away some of the drudgery. So in this case, the measurement of that lesion would be done automatically, but the interpretation of what that measurement means is still the key role for the clinician. And then the communication of that information to the patient and the rest of the care team such that it could be actioned, again, is a critical role for the human in the system. So in my mind, what we're doing, hopefully, is kind of turbocharging clinicians, if I can say it in that way, and enabling them to do more of what's really important, which is providing care, with some of the drudgery being done by computers in this case.
And can, with all of the information and the access to improved intelligence available, what are the current barriers to adoption, and why is access to AI within healthcare systems difficult? Yeah,
so it's certainly taking time, Jamie. I mean, the promise is not, it's not delivered yet in any meaningful way. There are a few examples, but we're definitely not there yet. And the challenges are pretty obvious, really. One of them is the one I've already mentioned, which is access to lots of data to allow us to train these systems and to really absolutely validate that they work. Because again, in the example I've given, no point using the system if the measurements it gives are not accurate. And how do you work out they're accurate? Well, you've got to validate. You've got to use lots and lots of examples. Thankfully, we've got good science here. But the only way AI is going to work is if we apply that good science and that good rigor to understand whether the model, the network, has learned something that's valid or not. So that's the first challenge, lots and lots of data. I think there's a challenge around about acceptability by both the patient or the general public and also the professionals. The professionals have to see it as being something that's suitable and helpful. And there is an inherent challenge in here in AI, which is that in some ways, particularly when using something like a neural network, the actual decision-making process is somewhat hidden. It's a bit of a black box in the sense that you give it lots of examples of someone who's got a type of cancer, you give it lots of examples of people who haven't got cancer, and then it learns the pattern of either cancer or not cancer. we don't really understand, and it's quite difficult to unpick that and understand why the computer made that decision. And certainly, if the clinical expert doesn't understand it, then they're less likely to believe it. So there's a number of different challenges in there: access to data, acceptability, and then there's a bunch of good stuff we have to do as professionals in here, which is to take genuine responsibility for control of data. I mean, we're talking about very personal information. If you're talking about scans of someone's body, it's very personal. And so as professionals, we have to take real responsibility for the control and security and appropriate use of that data as well. So these are just some of the challenges to adoption. I think the other one probably is just technical maturity. I mean, we're all aware that AI is exploding, and certainly the use of AI in systems that are now in daily use, you know, whether it's on an online social media tool that can recognize people's faces and things like that, we are aware of this technology emerging. It is still maturing, though, in truth. It's rapidly maturing, but it's not mature in many examples yet. So yeah, lots of challenges,
And Sotos, what more can be done on the research side by researchers to increase the use of AI-based diagnosis in particular?
I think there is certain elements that I think I should best explain about building AI and how do we think about developing an AI. And it's very hard to do this starting about math, so I have to talk about concepts. And I need some props. And my daughters were very kind to actually, I asked for 2 of them props and they gave me 6 or 7. So they're all sitting behind their cats and dogs. So imagine that you want to build an AI that is trying to tell apart a cat versus a dog. Okay, so this is a very scruffy looking cat versus you have something that looks like a baby, I would say. So this AI, you will collect a lot of images of, let's say, this type of like cats and dogs, and you will provide them to the AI. And the AI will start understanding what sort of these numbers exist, the patterns that will make, let's say, a cat versus a dog, will different snout shape or the body size, the body shape, and all of that. Now, let's say we'll make the AI a little bit harder. We'll ask an AI to say, well, not only you should tell apart cats and dogs, but also should be able to tell different breeds of each dog or each cat. Suddenly now, I need to provide lots and lots and more examples, okay? And now the AI must understand the very subtle differences between what makes one breed versus another, okay? And I want the audience to understand that the harder the task, the more and more examples I need to give. Now, if I can make the problem even more challenging, I will say to the AI, well, I don't want you to only tell me apart the breeds, but I can give you a new image that will be a mixed breed, and I want you to tell me which were the 2 breeds that created that breed. Suddenly now, we might have, let's say, 1,000 purebred breeds. Now we can create all these possible combinations. As you bring about all these possible combinations, you need more and more and more data to describe each combination. Very quickly, you will realize that some combinations of breeds will be very rare. And the rarer, the harder to find examples from. So it turns out that training an AI by pure providing examples quickly reaches a limitation. That in order to make the AI robust and work very well, I need to provide more and more examples of all, even the most rare, I would say, combinations of those that I might suspect. So essentially now, we will need to create a new AI, an AI that works in a different fashion. And there is now a new, I would call it breed AI, breed of AI, not that breed of an AI, but a new breed of AI that can actually work with fewer data. And it works by understanding what the data are about, rather than providing an example of this is that breed and this is that mix of a breed, like that's a Cavapoo. It can understand the principles behind, the concepts behind of what it means to be a cat, or what it means to be a dog, or what are the characteristics of a curly dog versus another dog, and so on. So the good thing is that once you develop such an AI that can understand the concepts, it can also provide these concepts as an explanation. And you can readily think, connecting with what Ken said before, that if I can create an AI that is not a black box, that becomes immediately useful, because I can say, I make this decision that this is a cavapoo for these characteristics, and I provide you examples of why I made this decision. And that's very, very powerful. And in medicine, we need that. We need the ability to explain why we have made certain decisions.
And how can computers see differently compared to humans?
Yeah, so this is again a very interesting question, and I'll start with it. I promise I'll start with the cat, but I will end up with disease. So it is easy to talk about dog and cat breeds, right? Because everybody sees them and understands them. We know the characteristics that make, let's say, a golden retriever, right, or a Labrador. But if you take about a lesion of an image of the brain, or and what happens because this patient may have had a stroke and there is somehow hemorrhage in their brain, how that hemorrhage will appear and where, it can be a variety of locations. It will have a variety of appearances. So it will be like actually having billions and millions combinations of possible breeds, okay? So in some sense, if we were to create the analog of, if I want to train an AI, I have to give a lot of examples. Very quickly, I will run out of examples. So to essentially be able to train an AI that is able to understand what disease looks like, you have to train an AI that tries to understand what makes different some part of the brain that has disease versus one that doesn't. It doesn't necessarily, so it has to understand why is that different from the other, rather than here is an example and learn from it. And somehow, maybe it will be a different intensity value. Maybe one pixel, the pixel is basically something that is a digital number within an image of a medical image. So maybe a pixel will be brighter, or maybe a pixel will be darker. So that is the characteristic, because that will be, the AI will understand that, this is not normal to be there because in all the other examples I didn't have it. So this must mean I have disease here. So it's a completely different concept. It's easy to describe a cat because we have the different ear shapes, but in disease, these characteristics are harder. And that's why radiologists are so precious. I mean, they are able to do this type of pattern recognition by training and by their experience.
And Ken, when will AI be fully interwoven into healthcare? We've talked a lot about the wonderful leaps forward it could provide in diagnosis, but when will you see it from diagnosis through to treatment, in your view?
Yeah, it's again an interesting challenge. So healthcare and healthcare delivery, and in fact health and social care delivery, are all about pathways of care. It's all about different stages within a process. And essentially, as a patient, you're guided through a system in a way. And that's all about workflow for the individuals involved in providing that care to you. So I think the key for AI adoption is actually to get it embedded into that workflow. And the way we do that as a technology company is a number of different ways, but mainly it's about breaking down that system into individual stages and trying to add AI almost invisibly at each of those different points in time, such that the workflow of the care team is not negatively impacted, hopefully positively impacted. So for example, at the moment in Canon, what we're doing is we're breaking down that pathway that says we take an image of someone when they're in the scanner, then we export that image to a system that then recognizes what their pathology might actually mean, and then we present that information to the human viewer. So what we're doing is dismantling each of these different steps and applying AI. So initial example we've got this now in the product, where we're using AI to improve the quality right at the time when the images are taken on the scanner. We're doing what's called reconstruction of these images in CT, and we're using AI to optimize the quality of these images. We've then also got a product called the Automation Platform, which we're using now in Canon Medical, to embed some of these AI routines into that system later on in the process, so the radiologist can get access to the interpreted data that's already been pre-reviewed by the AI system, again, so they can make that decision. So it's through these complicated set of tools, but trying to essentially embed them into the workflow that will allow us to get AI adopted effectively within health and social care delivery.
And I've got a question for you both, but Ken, I'll start with you. If you could change one thing to bring the potential of these technologies out of the research phase and into a clinical setting, what would it be?
Yeah, so again, back to what I mentioned earlier on, I'm afraid, for me, it's all about data. It's all about access to data that will allow us to create and then validate these systems. And validation is probably most important in this sense of getting them out there. And again, there's a combination of things in there. So just access to data. And I think all of us as citizens have a role to play here. We have a role to believe and to endorse the fact that our data, as long as it's safely handled and anonymized appropriately, that it can be used for scientific research. I think most of us would probably agree with that. Although some companies have messed this up and they've misused data, either accidentally or deliberately. I don't really know, don't want to get into that. But that's a thing that could really make a change, would be to access to data. And I think we have a role there to give our permission to allow that, our data as citizens, to be used for the greater good, essentially. I think part of that validation process also involves clinicians engaging with these systems when I'm afraid they're not perfect, to help us try and improve their quality and validate that they work in a useful way. So these kind of two, sorry, I'm giving you two answers when you ask for one, but these are the two combined things that I think would help us move forward.
And Sotos, the same question to you. If you could change one thing to bring all these technologies from research into clinical setting, what would it be?
I will give you two answers on the same things that Ken said with a different spin. So I think more data and easy access on this data for academic also research is very important. This will allow for more rapid development of solutions that then some of the industry then can really try to translate and integrate. There is a lot of opportunities and tremendous opportunities in using AI to help a lot of the societal challenges that we really face. But one critical element that we don't appreciate is that we need talent to develop all of these algorithms. And we need to be able to attract talent. We need to attract software engineers, data scientists, AI experts, AI students that finish with an AI degree, and so on. And what we don't really appreciate is that we compete for talent. We compete for the talent of an excellent student that will finish their PhD and that they want to do some research following on, whether they will go to the, let's say, the autonomous driving industry, or to teaching your smartphone to talk and understand what you say, depending on which brand you use. So we need to attract and retain this talent within the healthcare industry. And data to that is very important. But talent also appreciates when they see something that they develop become part of reality down the line. So from idea to product, if we shorten that time, it will help retain talent. It gives them, I would say, fulfillment, right? And here is the tremendous opportunity for our fellow colleagues and clinicians that play a very important role in this. That, AI is just a complete big complex piece of software that goes within another big complex piece of software. And doing all of this takes time, and they need to understand that there is development behind of this. They need to be open to the idea. They need to be willing to test new things, even if they're not going to be perfect. So progress is quick. We are doing rapid steps, but I want them to remind our fellow clinicians, how long did it really take us to discover antibiotics and test them? How long did it really take us to do vaccines and test them and accept them? It will take time with AI, but they must support AI research today, even more. It's more important that they do it today than yesterday. Openly share their knowledge, openly engage with academics and industry, openly share their data and whatever they know. They are part of the solution. I think they're part of the solution. I don't think they really understand that. So if I were to change, I would say, two things. I would say, yes, access to data, but also direct clinical involvement in how we develop the solutions.
And Sotos, what is next for your research in this area?
I promise here that I won't daydream and take another 10 minutes, but I will answer this question in two folds. But for me, I really like to see developing an AI that thinks and acts like a human, particularly when it looks at medical data. I'm not talking about these scary ideas of an AI that we see in the movies, but an AI that, thinks like a clinician when they read an image. It takes advantage of all the background understanding about what the patient is. Like, to an AI today, we saw an image and that's an image. But to a radiologist, they know much more. They know about the age of that person, they know their clinical history, they've read their record, so they somehow have more information about the patient than when you ask an AI that read an image and do something. So we need to be able to endow this ability also to this AI. Also, I think we currently develop AI that tries to diagnose, I would say, current health state. There is so much of opportunity to think of, can we somehow predict what will happen if we provide a certain treatment to this patient? Can we think of developing an AI that can somehow help clinicians understand that, for this patient, perhaps you should consider this possible 2 treatments. And if you give them this treatment, we suspect that the patient will come out of the hospital 2 days earlier. I mean, it's daydreaming, but I think it's important to daydream. It's important to understand what we can really achieve. And once we can do all of that, to kind of link to the initial thing that Ken said about the scanners, we can really imagine of a world where taking an imaging exam doesn't really mean like we have to take a day off and, go there and it looks like a dark room. It could be something more enjoyable. It could be something that happens more instantaneous. So, and AI can actually help shrink these devices. It can make them more simple to operate. It can be, again, linking it to the smartwatch. I remember my grandfather had all this, things that you can pump and you listen to your heart rate and all of this. I even forget how it's called. Now you wear it on a watch. So you can see how technology can shrink things. And I really hope, and I'm optimistic that AI will be a component that allows that shrinkage.
Sotos, Ken, thank you both for joining me today for this fascinating discussion on the role AI can play in addressing some of the most significant issues in healthcare today. And thank you for watching.
Thank you for having us.